Alright everyone, welcome back. Today, we're diving into a condition that every nurse will encounter at some point in their practice: sickle cell anemia. Let's settle in and take a calm but thorough journey through what this disorder means, how it develops, how it presents, how we care for these patients, and most importantly, how we can educate and support them. But before we begin, check out our extensive nurse test bank to help you pass nursing school and the NCLEX. Link is in the description below. So, let's begin with what sickle cell anemia actually is. Sickle cell anemia is a hereditary blood disorder, where the red blood cells, which should normally be round, soft and flexible like little donuts, take on an abnormal crescent or sickle shape. These misshapen cells aren't able to move smoothly through the bloodstream. Instead, they stick together, block blood flow, and break down much faster than normal red cells. The result? The body can't get enough oxygen to its tissues, leading to episodes of severe pain, fatigue, and damage to vital organs over time. Now, since this is a genetic condition, it's passed down through families. The key here is something called the hemoglobin S gene. Normally, people have hemoglobin A, which is healthy and carries oxygen efficiently. But in sickle cell, the person inherits a copy of the defective hemoglobin S gene from both parents. When they only inherit one copy, we call that the sickle cell trait. Those individuals are usually carriers and don't experience symptoms. But if they inherit the gene from both parents, the disease manifests in its full form. Let's talk about contributing factors. Because it's an inherited condition, the main contributing factor is genetics. It's most common among people of African, Mediterranean, Middle Eastern, and Indian ancestry. It's believed that this gene developed as a kind of evolutionary protection against malaria. People who carry just one copy of the gene have some resistance to the disease. But when two carriers have a child, there's a 1 in 4 chance that the child will be born with sickle cell anemia. Environmental factors can also make symptoms worse. Things like dehydration, infection, high altitude, stress, or even extreme temperatures can trigger a sickle cell crisis. So, understanding these triggers is vital in both prevention and care. Now, how does sickle cell anemia actually look in real life? What are the manifestations? Patients often present with episodes called sickle cell crises. These are periods of severe pain, often in the back, chest, abdomen, or joints, because the sickle cells are blocking blood flow. The pain can last for hours or days. Alongside pain, there's fatigue from anemia, because the sickled cells die early, leaving the body short on healthy red cells. You may also see pallor, jaundice due to increased bilirubin from cell breakdown, delayed growth in children, and frequent infections because the spleen, one of the body's key defense organs, often becomes damaged or non-functional from repeated sickling. In some patients, complications can be life-threatening. These include acute chest syndrome, stroke, renal failure, and leg ulcers. So, being able to recognize the early signs of crisis or complication is absolutely critical. Let's move into how we diagnose it. The gold standard test is the hemoglobin electrophoresis. This test identifies the type of hemoglobin present in the blood, confirming the presence of hemoglobin S. In newborns, screening is now routine in many countries, which helps start early management. Other diagnostic tests might include a complete blood count showing low hemoglobin levels, a high reticulocyte count as the body tries to replace destroyed red cells, and peripheral blood smears showing those classic sickle-shaped cells. During crises, labs may also show elevated bilirubin and lactate dehydrogenase due to hemolysis. Now, let's imagine you're the nurse caring for someone with sickle cell anemia. What do? Nursing actions focus on managing pain, maintaining hydration, preventing complications, and supporting oxygenation. Pain control is top priority. Most patients will require opioids during crises, along with non-pharmacological comfort measures such as warm compresses and rest. You'll also encourage oral or IV fluids to prevent further sickling, since dehydration makes red cells stickier. Monitoring oxygen levels and administering supplemental oxygen as prescribed helps prevent hypoxia. You'll also keep a close eye on vital signs, watch for signs of infection, and monitor lab results for anemia and electrolyte balance. Since these patients are at high risk of infection due to splenic dysfunction, you'll ensure that antibiotics and vaccinations are up to date. Emotional support is just as important. Chronic illness can lead to depression and anxiety, especially in children and adolescents who often face repeated hospitalizations and pain episodes. So, showing empathy and encouraging open communication is part of holistic nursing care. Let's discuss treatment. There is currently no universal cure, but there are several treatment options that improve quality of life and longevity. The mainstay therapy is hydroxyurea, a medication that increases production of fetal hemoglobin, which doesn't sickle easily, thereby reducing the frequency of crises and need for transfusions. Regular blood transfusions are also used to decrease the concentration of sickled cells and prevent complications like stroke. In severe cases, bone marrow or stem cell transplantation may be considered. This is currently the only potential cure, though it's not suitable or accessible for everyone. During crises, treatment focuses on managing symptoms, giving oxygen, fluids, and pain control, and treating any underlying infection. Nurses play a key role in coordinating all of this care. Now let's move into what's equally important: patient education. Nurses are the frontline teachers, and education can dramatically improve outcomes for these patients. You'll want to teach your patients and their families about recognizing early signs of a crisis, like pain, fatigue, or fever, and when to seek medical help. Encourage them to maintain good hydration, avoid extreme temperatures, and manage stress. They should also be educated about medication adherence, especially hydroxyurea, and the importance of follow-up appointments. Vaccinations against influenza, pneumococcus, and meningococcus are crucial, as infections are a major trigger for crises. Diet is another area to discuss. Foods rich in folic acid, like leafy greens, beans, and citrus, help support red blood cell production. For parents of young patients, genetic counseling is important to help them understand the inheritance pattern and make informed family planning decisions. And finally, reinforce that while sickle cell is a lifelong condition, with proper management, many patients live full and productive lives. Let's take a quick pause here. Imagine you're in a clinical setting with a patient admitted for a pain crisis. What do you do first? You'd likely start with pain assessment and pain management, right? But alongside that, you'd be ensuring fluids are running, checking oxygen, monitoring for signs of infection, and providing reassurance. These steps all come together to make the patient feel safe and cared for, and that's the heart of nursing. Before we wrap up, remember that patients with sickle cell anemia often develop resilience and strength through their experiences, but they still need compassionate, consistent support from healthcare providers. Each hospitalization can bring anxiety and fatigue, so kindness and education go hand in hand with clinical skill. Let's finish up today's topic with a quick round of true or false questions to test your understanding. Ready? Here we go. Sickle cell anemia is an acquired disorder that develops later in life. Answer: false. It's a hereditary condition present from birth. The primary cause of sickle cell anemia is the inheritance of two abnormal hemoglobin S genes. Answer: true. Dehydration and infection can trigger a sickle cell crisis. Answer: true. These are major triggers. The hemoglobin electrophoresis test is used to confirm the diagnosis of sickle cell anemia. Answer: true. During a crisis, applying cold compresses to painful areas helps relieve pain. Answer: false. Cold constricts blood vessels and worsens sickling. Use warmth instead. Hydroxyurea helps reduce the number of crises by increasing fetal hemoglobin levels. Answer: true. Patients with sickle cell anemia should avoid all forms of exercise. Answer: false. Light to moderate exercise is fine. Dehydration and overexertion should be avoided. Blood transfusions may help reduce the concentration of sickled cells in circulation. Answer: true. Sickle cell anemia affects only the blood and has no impact on other organs. Answer: false. It can affect the spleen, kidneys, brain, heart, and bones. Education about hydration, infection prevention, and medication adherence is essential in patient care. Answer: absolutely true. And that wraps up today's 20-minute lesson on sickle cell anemia. Remember, Your role as a nurse goes far beyond medications and monitoring. It's about helping patients understand their condition, preventing crises, and offering hope through every interaction. If you keep that in mind, every patient with sickle cell anemia you encounter will feel truly seen, supported, and safe in your care.